So last week, Barack Obama sent a letter to Ted Kennedy and Max Baucus, who are the two chairmen of the two relevant committees in the Senate on health care, and he pretty much came out very strongly for the public plan, endorsed it pretty much, and that's been a slow trend.
Tell me what the public plan is.
Right. So the public insurance option, which I think is the precise way to put it, would be, in all of the healthcare reform plans we're talking about, the idea is always going to be a choice for people of health insurers. You'll enter into a health insurance exchange, basically like a marketplace, and you'll see Aetna compared to Kaiser, compared to United Health, whatever, and you'll decide based on cost and quality and reputation and whatever else. And what liberals want, and some in the center as well, is a public competitor there. They want a public plan, a plan run by the government, where you can say, I want to be in this plan that doesn't have a real big incentive to not give me health care insurance if I'm sick, and employ a lot of claims adjusters to reject what I'm doing. And now there are a couple versions of this. One is a very strong version of the public plan. It's like buying into Medicare. So it gets to do what Medicare does and basically set its own prices, which makes it a lot cheaper than private insurance. The Commonwealth Fund has estimated about 20 to 30% cheaper. I don't think that version of the public plan stands a lot of chance, although it is pretty near to the version in Kennedy's bill, which by law would have to, if I have this right, would have to pay about, I think it's 10% more than Medicare.
So what does it mean for, in the strong version, what does it mean for the plan to be able to set its own prices?
It would mean that the plan becomes a lot cheaper than private health insurance. It would mean that providers get squeezed.
Why would it be cheaper?
So, I mean, it'd be cheaper essentially for the same reason it's cheaper to buy something from Walmart than the bodega. That when you have the backing of 60 million, 80 million, or I think it's actually less than that in Medicare, 45 million if I remember. You can negotiate pretty low prices. I mean, they pretty much do it legislatively, but a doctor could say, I'm not gonna participate in this. I'm gonna have no part here, and the doctor could just say, this isn't worth it for me. But they don't. It's worth it for them. It's a huge amount of volume. And the prices aren't that low. The government, they're lower than they are in private health insurance, but not so low that doctors feel that it is not profitable to treat Medicare patients. Meanwhile, sort of private insurers have a much more sort of fractured bargaining system. They don't extract as good deals. They don't have, that sort of market share. So they don't get anything like the same prices. So the idea would be, in the strong version, the public plan can get similar prices to Medicare. It becomes a cheaper alternative to private insurers, and if they can figure out other efficiencies or ways to compete, either through better service or whatever, that the public plan would grow and grow and grow. And it may be, some people tell you then it becomes like single payer, and some people just say it becomes a very big public plan, and but so that's a very strong version.
But the main idea, and you are the expert on this, and I've been trying to catch up earlier today, reading a bunch of stuff. The main idea, so. My understanding of the way the lay of the land is because when I read, say, about the strong version of the public plan, it looks pretty clear to me, just reading a number of things, that the idea is that this plan, because it would be able to have certain kinds of price efficiencies, the idea is that it would kind of crowd out a lot of the private system, and then you'd kind of like back into something like a single government health plan. And so the thing that, first of all, then I think, well, why not argue directly for single payer? Why did that get off the table? And I'm actually curious about that. Why are we talking about these various convoluted plans instead of just let's have the government pay for it? Let's just bring every single person under Medicare, and that's it. Why not do that?
Well, let me go backwards. So so why did the public plan become part of the discussion at all? And I think the reason for that is in 1994, what liberals and pretty much everybody learned is that the problem for a lot of health wonks looking at health insurance is that the insurance system is really bad, and we need to do something that either radically modernizes it or changes it or replaces it. So you could radically change it through what, like, Wyden Bennett wanted, which would just be to end employer-based health insurance, but it'd still be private. Or you could do something like Clinton wanted, which would be, everybody moves over to this managed care and managed competition weird structure. Or you could do what sort of an old-line liberal would want, which is single-payer, and the government just insures everyone, much like Medicare. But they realize that you can't do that. Whatever you do, no matter how bad the problems are right now, you can't take what people have. That there's a lot of status quo bias in healthcare insurance. And so the question becomes, how do you absorb that political insight into your plan, but not totally let go of the ability to actually get out some efficiencies to reform the system. And so the idea here became a public competitor. But to go to your first point about whether or not it sneaks single payer, a lot of liberals would like it to be. But I think that the strong version public plan that I was just sort of outlining to you has very little chance of being enacted into law. That I think that what most people now think a sort of a win for liberals would be, or a win on it would be something that sort of the Center for American Progress has come out behind, and the New American Foundation has come out behind, and Obama has come out behind, which is what's called sort of a level playing field public plan. And this public plan is basically like a nonprofit insurer run by the government. It gets no subsidy from taxpayers. It can't bargain with Medicare rates. It can only bargain like a private insurer, just sort of going up to a doctor and being like, I would like to pay you X. The doctor says, no, well, I'm only going to give it to you for Y. There's no sort of setting this in law. And it essentially has no special advantages. The only difference is that, in theory, it has slightly different incentives. That its incentive is to give people, quality health insurance, rather than sort of try to juice up the quarterly earning reports. I think there's, good reason to be skeptical of how different that plan in practice will be. But there's also a lot of reason to say that it can't do much harm and might be a lot of good.
How different it would be from
any other health insurance plan, from any other nonprofit health insurer, from any other even private health insurer, if it has to meet its own sort of earning objectives and on and on. But I think that there's a lot of reason to say that it probably can't do much harm in that guise, and it can do a lot of good. That one thing you're going to see, and I apologize for readers, for viewers, that we're getting into the weeds here, but there are going to be these health insurance exchanges where everybody sort of buys health care, and the concern is that the bids that the private insurers are going to offer to cover people, the premiums, are not going to be really as low as they should be. That a lot of healthcare wonks have brought this up to me, not particularly liberal people. The idea is, with a public plan, you have a pretty honest bidder in the market. And so at the very least, it reduces the incentive, because if the public plan is bidding a lot lower, then it's going to get a lot more people. Private insurers will lose value, will lose market share. That would be bad for them. So that it creates useful competitive pressures, and that there's no reason not to try it out. And so that's sort of the weaker version.
Okay, so,
and then, of course, there are a lot of folks
who
who want no public plan at all.